Hey guys, it's Alex here. Just recording my video for FTM Kickstart this week. The topic is open. Um, I've been thinking a lot about this video and what to talk about. I kind of decided to talk about my career and working in a female-dominated field and how that's been for me. Um, so I am 23 years old. I'm a master's student in clinical social work. Basically, I'm training to be a therapist. I've known that I wanted to do this ever since I was a kid. I just loved mental health. I loved psychology, and it just, from like my first years in high school, I was taking, you know, as many psychology classes as I could and reading the books and yada yada yada. But back then I was female, and it was pretty, you know, there was definitely more women in psychology than men, but it was a fairly even divide. But now I've kind of shifted into social work, and that's been interesting for me because social work is like 90% women, and I definitely felt that pressure to, I don't know, to have stayed in psychology. It's kind of weird. Like, it really only comes, well, it mostly comes from family. I think that it expected me to stay in psychology and get a doctorate in that field. But then I thought about it and I was like, okay, I know I want to be a therapist, and if I go into social work, into a clinical program, I can get my master's and I can be out and have a private practice, once I get licensed. So that's like a 2 to 4 year process with licensure as opposed to 6 years getting a doctorate and then having to do a postdoc and then getting licensed. And it's like, it's a really big process. Not that being a PhD psychologist isn't a great thing, it's totally worth it too. But I realized that for my purposes, it just made more sense to kind of go this route. Anyway, I digress. So the issue that I'm kind of having though is that now that I am in social work, it's like it's all women. My classes are mostly taught by women. In a 20-person class, there will be one or two guys in there, and it's kind of isolating. It's weird to be the minority as male, and I feel like I have to be careful in certain environments, especially in classes if we're talking about women's issues or things that don't really relate to men as much as they do relate to women. I really have to watch what I say, and I have kind of gotten used to that in general because it's not just with school, but it's with various things. Not having not appearing as someone who ever lived as female, I feel like I do have to be extremely careful about what I say so as not to offend, because I am speaking from a place of privilege. There's no denying that. But in my undergrad, I did a psychology major, and I also majored in women's studies. Um, and I don't mention that anymore because it just feels uncomfortable. I feel really ashamed of that, and I know the people that I went to school with would be pretty bummed to hear that I don't even mention that part, which was really important to me back then and all the people that I met in that program. But at the same time, it's like now saying that did a double major in women's studies. I have to explain it. It's ridiculous. I mean, it was more women's and gender studies, but at any rate, even gender studies, it's like as a male, there's like, oh, okay, so you're gay? I mean, it's a ridiculous stereotype, but it's true. I mean, it's like people expect you to be, gay or in some way queer if you were studying gender studies as male. Anyway, um, so it's kind of like it's frustrating. I mean, I feel like I can't really be myself sometimes when it comes to, kind of this female oriented part of me that just kind of developed because of what I'm interested in and what I've studied, and I feel like I really do have to kind of tone that down. And it's here's another example. I was an intern in a hospital last year, basically I was in the ER and I was in the transplant unit doing mostly psychosocial assessments of patients. So in the ER, I mean, you're seeing a lot of trauma, you're seeing a lot of, high intensity kind of cases, really charged, emotionally charged situations and just people in general. So the psychosocial assessments there are really intense because of the kind of topics and issues that you're dealing with. So I remember this was when my maleness kind of really hit me. Um, I was shadowing one of the social workers in the ER who was about to do an assessment of a woman who had been sexually assaulted, and I, you know, I, I mean, you can't really say you've studied this stuff, but having taken a lot of women's and gender-oriented courses, it's an area that I'm very familiar with in terms of what to say, what not to say, how to handle situations like that. Um, but at any rate, it was like my maleness immediately was like, that's all that was seen. And the social worker said, you shouldn't come in for this. You shouldn't, if that's okay, I'm sorry, but I don't think this is really appropriate. And I was like, yeah, I mean, I get that. My presence as male is triggering, and, this is a very sensitive situation, and this person, probably didn't, would not want my presence. I understand that completely, but it was like, wow, I'm very, I don't know that my presence could be triggering for somebody. Made me really sad because I, really enjoyed my close relationships with women and being able to kind of support each other in, in kind of this, I don't know, this special way. I think that women have a connection with each other that men and women don't quite achieve together. I don't know. It could just be my bias and my past experiences, but I just feel like, especially in these, feminist, explicitly feminist and kind of women-oriented circles, there's just kind of this connectedness, and I do miss that. I think as a result, I have gained something. I do feel um, closer to guys, and I do feel more of a kinship there than I have before. But it's kind of like, I guess I didn't think that I would think about losing that. When I made the decision to transition. So yeah, and in general, I'm still just trying to get used to being, if there's 100 social workers in the room, a handful of those people are going to be guys, and that's just the life that I've kind of created for myself, and I'm okay with it mostly, but I'm still getting used to it, and I think part of it too is that the associations that people have with social work. At least where I came from, I grew up in the South. I live in Chicago now, but I grew up in a culture where social work was very ostracized. People, in general, were kind of against it, in terms of giving people handouts and welfare and just these very general terms that people would use to describe what social work entails. And so that was, I've kind of realized how much of that I internalized because I experienced that now when I feel like I'm not good enough, that I'm not going to be a psychologist, and I'm going to be a clinical social worker. I don't know. It's crappy, and it's not the truth. I mean, I think that we as social workers do a lot of very important things for people, and I think especially for the trans community. But at the same time, it's like those stereotypes, when you hear them and are exposed to them for so long, it's like you internalize them, and you can't. It's really hard to not do that. Even with the classes and the experience that I have, getting past those early associations has been really hard. So anyway, this is just kind of a rambly video, but at least you kind of know a little bit more about me now, and feel free to ask me any questions about anything I've talked about. And alright, hope you guys have a good week. See you next time.